now we are going to focus on the clozapine. So clozapine, and we are looking at the treatment guidelines for the clozapine. So we need to know firstly the indications. The indication is that it is a treatment resistant schizophrenia. So treatment resistant schizophrenia is the indication, as well as it can include the schizophrenia associated with the suicidability. So treatment resistant schizophrenia as well as schizophrenia associated with the suicidability. So how do you consider the adverse effects of this? So adverse effects, it includes clozapine is the agranulocytosis, important. Then comes the presence of seizures as well. Then there is also the myocarditis and the metabolic syndrome. So this was about the clozapine treatment guidelines. To learn and grow daily like this, please do subscribe.